Okay, so we'll make a start. So welcome everyone to the Mental Health Nursing Research Unit Journal Club. This is the first Journal Club 2022, and delighted to welcome Dr. Sam Hartley, who's going to present one of her papers today. So she's going to be talking about effective nurse-patient relationships in mental health care. And I'll hand over to Sam in a minute so she can introduce herself. But just to say that the format is roughly split 50-50 between Sam starting off giving a bit of an overview of the paper, which hopefully you've all seen anyway and familiar with. And then the final 10-15 minutes is allocated for discussion and question and answer. So I'll hand over to Sam. Just to say we are recording as well, so just to make people aware if they're asking questions and things. I'll hand over to you, Sam.
Thank you. Thanks very much, Rob. Yeah, so let's see if I can move my slide along. So just a bit about me before I get into the paper. So my name's Sam, as Rob said. I'm a clinical psychologist and I work in Pennine Care on the Hope and Horizon units, which are two inpatient CAMHS units that serve kind of across Greater Manchester. I've worked there since I qualified, and actually I did my final year training placement here as well before I qualified, and I liked it so much that I got a job here afterwards. I was lucky enough to get an NIHR integrated clinical academic clinical lectureship, which is like a postdoc fellowship, and I finished that in April. That was along with between Pennine and the University of Manchester, and this systematic review was one of the papers I did as part of that fellowship. Okay, so this is the paper. I did my first systematic review as part of my PhD a long time ago, and I'm not quite sure why I keep choosing to do them, because they're quite hard things to do and they take a long time. Sometimes it's like swimming through treacle, but this seemed, as part of the fellowship, is a really important part of that fellowship. And I guess today I'm just going to go through the paper bit by bit, just think about the aims, the methods and the key findings. In terms of the aims, I guess as part of that broader fellowship, what I was trying to do was to understand and support effective therapeutic relationships in inpatient CAMHS settings. So I guess before I got to some of the other work in that fellowship, which was doing some qualitative research, doing some intervention development, I wanted to really identify and evaluate the evidence for existing interventions that related to effective therapeutic relationships between nursing staff and people in mental health services, because as we all know, therapeutic alliance, therapeutic relationships are a really key determinant of positive outcomes. They're the foundation for therapeutic change. So I wanted to see, okay, we know they're the foundation for therapeutic change, but what evidence do we have for interventions to support them, to actually scaffold, support, facilitate them, and to help staff to develop and cultivate and sustain these relationships? So I wanted to gather the evidence for that, look for any gaps in the literature, and for my kind of work in particular, I wanted to see, okay, what evidence do we have for interventions that I can utilise to develop a specific interventions for a child and adolescent setting. So the method was a systematic review, but it didn't include a meta-analysis. It was narratively synthesised. I screened 3,830 papers, and also did some inter-rater kind of ratings on the decision about whether the papers were included or not, just to check for reliability. And we also did a quality assessment, which was the EPHPP. I can't remember what that stands for now, but it's listed in the paper. That's a way of checking the quality of the studies. So as well as looking at the nature of the evidence that different studies are contributing to the review, you can also look at the quality of those studies, so you can kind of weight them when you're summarising the evidence. I guess the key finding for me, before we even get into the nitty-gritty of what the detail was, the key finding for me was that there was only 8 papers that included in the final review. And that to me was surprising and important, because there's a huge amount of literature that conceptualizes therapeutic relationships in mental health care, that demonstrates how important they are for good outcomes in mental health care, that links them to other outcomes and process mechanisms and all that stuff. But actually, there was only 8 papers that presented evidence related to interventions to support therapeutic relationships. And that to me is a massive gap, because essentially it means that we're agreeing that this aspect of care is absolutely crucial, but we're not necessarily always providing staff with effective ways to help them to create therapeutic relationships. And I think that might be for different reasons. So one reason might be that the idea of therapeutic alliance has kind of come from the psychotherapeutic world, where people do one-to-one therapy, and there's some mechanisms there to help with that, like one-to-one clinical supervision. But actually what we now know is that the alliance is really important in lots of different types of relationships: care coordination, nursing relationships, key worker relationships, group settings, ward settings. And what we don't have yet is any good quality or robust evidence for any intervention to support therapeutic relationships between staff and patients in those kind of broader terms. There were some indications for further investigation. So some of the papers presented evidence related to staff training, related to psychological formulation, so bringing staff teams together to think about what might be going on and why, for reflective practice groups, for psychological consultation, and for shared activity. And those are some of the ideas I've since built on following the review, in terms of how we could develop an intervention package for this to support therapeutic relationships. And so I guess another key finding for me that I've definitely learned even more since trying to develop my own intervention package is how difficult it can be to design, to implement and to evaluate these kind of interventions. And that's because relationships are quite complicated, and the settings in which the relationships occur can also be very complicated. So, for example, if I wanted to implement an intervention on our inpatient ward to support therapeutic relationships between staff and young people, I've got multiple staff, I've got multiple young people. There are relationships across and throughout the system that will wax and wane over time. And I've also got a lot of other massive amounts of other confounding factors. So I've got what the staff member brings to the relationship. I've got what the young person brings in terms of their mental health needs, their physical health needs, the stage of the admission. And I've got a system that has lots of processes and procedures. So people have medication, there's observations, there's activities planned, there's meal times, there's things like community meeting, there's ward round, there's individual care plans. So creating and crucially evaluating an intervention that targets something that's so complicated in such a complicated context is quite difficult. So that made me think, I kind of understand a bit maybe why there's only 8 papers, because it's quite hard to do this work, and maybe we need to think a bit more creatively about how we align our evaluation methods with the context and with the aspect of care that we're trying to evaluate. So for me, that means thinking about robust research methods, like, for example, cluster randomized control trials, but they require massive amounts of resource. And it also, for me, means thinking about evaluation methods as well as research methods, and about qualitative information, about novel ways of kind of collecting data. So I guess to sum up, there's therapeutic relationships are incredibly important. Most people would agree that, the systematic review has shown that there is no robust evidence really for effective interventions to support those relationships, but there are some indicators that we could build on with evidence, build on with intervention development, but we might have to be a bit creative about how we gather that data, because the context and the concept is quite complicated. Okay, I'm going to stop sharing my screen and hopefully we can have a conversation.
Thanks, Sam. That's brilliant. Really great overview of the study. It's such an important area as well. I'm sure people will have questions. Probably easiest if people want to put the hand up using the icon at the top, and I can sort of invite you to ask you questions, Sam. Does anyone have any sort of comments or reflections or questions for Sam? Ben?
Thank you, Sam. I feel for you, searching more than 3,000 citations and pulling out 8 nuggets. It's a tough job, isn't it? Without a doubt. And I kind of share your concluding observation that this is important. Therapeutic alliances are really, really, really important. I'm just wondering, is there possibly a sense in which it's all very taken for granted? Mm-hmm. People know it's important and they know it when it's not there, but in reality it's kind of poorly specified and is definitely hard to measure. Is that?
I'd absolutely agree with that. Yeah, I think there's something about that it's almost paradoxically kind of forgotten about because it's so fundamental. You know, we talk about therapeutic techniques, about practical strategies, and the kind of first point on any kind of plan with that is always build a rapport, develop a therapeutic relationship. And actually, it's really hard to do, number one, but also it's not something you can tick off on a list because you've got to keep coming back to it, and there'll be ruptures and it'll be a bit of a roller coaster and there'll be things that impact it. So for me, yeah, absolutely, it's something that I think we've maybe assumed just happens, and in a lot of cases it does just happen, and people do this work in really compassionate and effective ways. And my take on it is, if people are already able to do it, even in quite difficult circumstances, if we could give them just a bit of scaffolding, a bit more scaffolding, then the outcomes could be even better. And I think as well that means that it has to be recognised systemically, so it has to be recognised by funding, for example, and the way services are managed and structured. There has to be this has to be prioritised, because otherwise nothing else will work. You know, your DBT, your CBT, your whatever won't work if you haven't got a therapeutic relationship. And even I would argue your care coordination won't work. And staff are really skilled at these relationships, and yet sometimes I think the system doesn't support them to develop and sustain them.
Brilliant. Thanks, Sam. Thanks for the
thank
question,
you.
Ben, as well. Anyone else have a question for Sam? Ben, go for it.
Yeah, maybe I should have waited longer for others, perhaps. It's just a thought that occurs, which is in an era. So we were speaking just before you started speaking, Sam. Rob, before you introduced Sam, just about how technology enables people to kind of meet in a way that we wouldn't have previously, and I wouldn't have been able to get on a train to travel from South Wales to Manchester. Extrapolating or learning from that and thinking about what that might mean for mental health care and interventions, where there's probably more of that happening online, and what does that mean for relationships, and are there I'm not sure I'm arguing for this, but are there some more technically mediated interventions that are kind of making a claim for effectiveness based on technique and less about relationships? some modalities that are saying maybe this stuff isn't in all cases as important as we assume. I'm not sure where I am on that, but
I'm not sure where I am either. I think given such a difference in format with digital delivery, there has to be a renewed research efforts for how the Alliance is experienced online. I know people are already doing that work. When I was a trial manager on a trial that used telephone therapy, and we investigated the Alliance there, and that seems like such a world away from kind of Teams calls, just being on the telephone. But I think there are people investigating that, and I think we do need to, because online delivery will work for some people and it won't work for others. And I'm talking about both patients and therapists or clinicians, and maybe the Alliance will be slightly different over digital delivery, and maybe aspects of it will be harder than others. I've been having my own therapy for a while, and part of that was over Zoom, and we've gone back to face-to-face. And there's definitely things that are different for me. And I've read lots of testimony from people who use therapy services that have spoken about how hard it is to build an Alliance online, or other people who've said how grateful they are that they've been able to access therapy in that way. So I do think it's something we need to be asking those questions about, and understanding. And I think I referenced it in the systematic review. There's even research about the Alliance with chatbots that are delivered in therapy. So people are investigating the Alliance with non-human therapists, if you want to call them that. So it's not, digital delivery is not an area I'm drawn to personally, but it's an area I certainly think we need to understand relationships in, because things will be different. And if we're saying we all agree relationships are so fundamental, we have to understand them in that new context.
Brilliant. Anyone else have a question for Sam? I might ask you a question if that's all right, Sam.
Yeah.
So a couple of questions. So one was about when you were screening the thousands of articles to get to the.
In my PhD I did 10,000.
Well,
so
yeah, I don't want to play top trumps, but I just did 12 for another.
Yeah, that is top trumps. You win.
Yeah, I suppose I was wondering, did you, so if you had the sort of magic grant funding tree, where would you be putting the money in terms of areas where you think it might be promising to promising interventions you think should be maybe looked at in a bit more detail to try and address some of these issues?
I think I am biased as a clinical psychologist because I'm drawn to things that I know more about, but as also within the systematic review, what was indicated was things like formulation, psychological consultation, alongside shared activity. Time, people need time to be together fundamentally to build relationships. So I guess I don't think sometimes we evaluate, because it's hard to evaluate those more systemic team-based interventions. I don't think we do it enough. So I'd be thinking about relationally focused clinical supervision, relationally focused team formulation, relationally focused staff reflective practice, alongside some of the more practical things about making sure staff have time to do this. And running alongside that, there's got to be lived experience involvement, because people will bring different perspectives to this, and we need to, if we're developing interventions to support therapeutic relationships, we have to do that via a process that mirrors the values of good therapeutic relationships, which is all about collaboration and open communication and mutual respect and all that stuff. I think James has got his hand.
Yeah. James, do you want to ask your question?
Yeah, hi there. Thank you for allowing me to attend. So just so you know, I'm a student mental health nurse. My question is, Sam, is if you'd have done it again, would you have changed the criteria so you had more than 8 papers, or do you think that would have actually taken away sort of almost the quality or the specificity?
I don't think my criteria were that strict. I don't mean I might be misremembering because it was a while ago, but I think I basically just said it needed to be in a mental health care context, and I was specifically interested in nursing relationships, but that again was broad. It was just nursing in mental health, and that it needed to provide some data on an intervention. So I was surprised that there weren't more papers. I think we could expand it in terms of the workforce. Definitely we could, because every clinician in mental health care develops therapeutic relationships. You can't not. So I think one thing would be we could have expanded the workforce criteria and had it more broadly across. And I guess I didn't exclude papers that also included other professional disciplines. It's just that it had to include nursing staff.
Okay, thank you. I was only asking, so I'm getting ready to write my own dissertation, so it's kind of like thinking.
Oh, great! Do you know what you're doing it on yet?
Yeah, thank you. Yeah, I'm doing it on the impact of physical exercise on adolescents' mental health.
Oh, great! Oh, you should talk to Rebecca Carney.
Okay. I'll jot that name down then.
I'll email Rob and he can pass it on, or you email me.
Or email me. I can put in touch with Rebecca.
Thank you.
Yeah. Does anyone else have another question or just reflection on the paper or thoughts about the paper? Well, I might ask another question, Sam, if that's right. So with the paper, you were looking specifically at interventions that had improved therapeutic relationship as the outcome. Is that right? So as a sort of as a primary or a secondary outcome for the studies?
I think either. I think it could have. It just had to look at that to some degree, because some of them definitely had multiple outcomes. And I remember the consultation one had multiple outcomes on it, because I remember I was kind of trying to leaf through the big tables in the in the different papers, because it is a hard one. It is a hard one to measure, because we also don't have. So the classic therapeutic alliance measure one-to-one therapeutic relationships, whereas if you've got a team, you might be more interested in how the relationships function as a whole, or you might be interested in a one-to-one relationship still, but then you need that key worker to have had a sufficient dose of the intervention, if it's a team intervention, if that makes sense. So it all just gets quite complicated. And I wish I had a more methodologically focused brain to figure all that out, because I'm sure someone could figure that out and design something really cool. But I don't think it's me.
But are there ways of measuring therapeutic relationships? Say if someone's admitted to a ward, for example, are there ways of measuring
there's
that person's
like
relationship with an organisation?
There are a few different ones, but not for me. I couldn't find the perfect one for what I needed, which was that kind of thing in an adolescent setting. There's the ward atmosphere scale, which touches on relationships, but is also about other things, other ways that the ward feels to people. And then there's newer kind of versions of the ward atmosphere scale. There's one called the voice measure. I can't remember what it stands for, but I can let you know. And there's things like the family engagement scale, which is the engagement between a kind of family unit and a ward, for example. But I think new measurement development would be really helpful, and crucially for me, something that's really quick, that's like 5 items that a staff member could do as part of a shift, because you can't be asking nursing staff on a shift to do a 25-item questionnaire. It's just not. It's not a good thing to ask, I don't think, even if it was practical, which is not.
Do you think that sort of measures which look at sort of a relationship between an individual and perhaps a larger organisation, do you feel like that's getting at the same construct as a one-to-one therapeutic relationship, or are you talking about something slightly different?
I don't think it's always exactly the same, but I think that there are elements that are the same. So as you know, Rob, I'm really into cognitive analytic therapy, and that would say that the relationships we have with ourselves and others can also apply to to organisations or to systems or to groups. But I do think there is something slightly different, because inevitably a relationship you have with one individual would be more intimate or kind of closer, or and I don't know, kind of more emotionally charged, maybe.
Yeah, brilliant. We've probably got time for one more question or comment, if people have one, before we finish off. I can't see any hands up, so shall we finish there then?
Mm-hmm.
Well, thanks very much, Sam. That was
great.
I really
Thank
appreciate you doing that. It's really
Thanks, everyone,
interesting
for coming.
paper. Yeah. I'll send out the invites for next month's Journal Club, and Catherine Berry's presenting next month, so that should be an interesting one.
It definitely will.
Yeah. But yeah, thanks again, Sam, and see everyone again soon.
See you later.
Thank you, Sam.
Bye.
Cheers.
Bye now.
Nice
Bye,
to meet
everyone.
you all.